As China races to vaccinate its people amid the biggest holiday of the year, how are vaccine companies addressing questions over safety and efficacy? I talked to a representative from one of China's biggest vaccine companies. And amid the pandemic, economic woes and political tensions, 2021 is off to a rocky start. What are the top risks? How should we brace for the bumpy ride? I have an exclusive interview with Ian Bremer, president of the Eurasia Group. Welcome to The Point, an opinion show coming to you live from Beijing. I'm Di Xin. China has already administered nearly 23 million doses of COVID-19 vaccines as the country's campaign intensifies to vaccinate 50 million people before next month's Lunar New Year holiday. That's according to a National Health Commission official on Tuesday, the 26th. But what challenges are vaccine companies confronting in terms of logistics, and how are companies addressing concerns over safety and efficacy? Earlier, I had the pleasure to speak with Helen Yang, Senior Director of International Business Development of Sinovac Biotech, which produces CoronaVac, one of the Chinese vaccines being used across China and abroad. I started by asking about how the CoronaVac late-stage trials were conducted, especially among elderly people. Let's take a look.
Actually, elderly people were part of our volunteers. In phase 1 and phase 2 trial in China, we conduct the trials to the population at 6 years old and above. And I remember the oldest volunteer in our trial is 89 years old. And also in our Brazilian trial, also include the elderlies. So based on the study, in I think over 2,000 elderly people above 60 years old, and we have seen a very good safety data as well. And from our phase 1 and phase 2, we see the seroconversion rate, meaning the level the antibody arise after getting the vaccine is comparable to a healthy adult aged from 18 to 59 years old, which we think is a very encouraging results.
What about the overall safety of elderly people getting vaccinated using either your company's vaccine or other companies' vaccine that are out there? There have been reports of incidents of older people dying shortly or days after receiving vaccine. They are said to be frail and old, above 80, and it is not totally established that these deaths are definitely linked to their receiving the vaccination. So what is your recommendation? What is your company's recommendation to people that are aged 80, for instance, in terms of whether or not they should be vaccinated?
Right. Actually, I think elderlies are part of the high-risk group. And in many different countries, when they are developing their strategies of start rolling out vaccine campaign under emergency use, elderly people are recommended. Like in Brazil and Turkey, they all already started to vaccinating people aged 80 or even 90 years old. And based on our study that we provided, the inactivated vaccine is very safe to elderlies, and we have seen that antibodies can be induced after elderly people receive the vaccine. So we think because most of the severe cases and hospitalized cases or even fatal cases are coming from this vulnerable group, and we do recommend that they need to be protected as a high priority.
How about those elderly with underlying medical situations?
Well, I think for different countries, they have different healthcare condition. But we think the early, for vaccination, of course, the early the better.
The World Health Organization does not, at least for now, recommend a certain vaccine for children under 16 and for pregnant women. But I understand that Sinovac announced that it's starting phase 1 and 2 trials amongst a 3 to 17-year-old group. Does that mean that your vaccine could be safe for these groups and for pregnant women as well?
Well, actually, for all the recommended vaccination needs to be based on the scientific research. And that's the reason why we need to conduct studies on the pediatric population and adolescent, which we are currently conducting in China. And we didn't do the phase 3 trial on this population yet. I think previously, based on the incident rates, these group of people seems to be relatively safer comparing to adults and elderlies. And of course, from the ethical study, from the ethical point of view in the past, also it is firstly to conduct a trial on healthy adults and then go to elderly and lastly go to pediatric. So there are studies ongoing and we plan to do it, to complete it first in China and then we need to do it further in phase 3 in other countries as well. And also the pregnant women were prepared to conduct a trial among this group of people in Brazil. We're currently preparing that with our partners.
And again, because of the low incidence rate of this vaccine, of this disease here in China, so you have to do the phase 3 trials in foreign countries. Is that the same situation here?
Yeah, that's very likely.
Okay. Is it necessary for people who have already recovered from coronavirus to be vaccinated? How about asymptomatic patients?
Yeah, they can. Actually, we do have some people who are positive and then they get vaccinated again.
The presidents of certain countries have publicly received your company's vaccine to encourage the public to follow suit, and some people are still taking a wait-and-see attitude. Is this sensible? What would you tell them?
Well, I think while we're receiving a vaccine, firstly, at the beginning, of course, the supply is not plenty because we need to produce the vaccine lot by lot. And we recommend different government and peoples needs to use their best effort to use the vaccine in the most targeted group, high priorities, because the purpose of using vaccines is to help the society and go back to normal and economic activities can get restored. And I think based on the studies we conducted and also the large amount used of the vaccine in China under emergency use approval, we have the vaccine has been approved to be safe, and also it can be provide the antibody level. And based on the efficacy study we conducted in other countries, and the vaccine is showing to be effective, and therefore that we think this is a vaccine which is safe and effective and which needs to be used.
In general, what would you tell people, whichever vaccine they can get their hands on? Do you think, would you say that go ahead and get it, even if there are reported incidents of severe side effects?
Well, I think for some side effect, for the large amount of use, massive use of the vaccines, side effect could happen. Either it could be caused by the vaccine, or it could be a coincidence. It's a coincidence. We don't know, but it could be a situation. So people need to analyze about how to deal with that. And for Sinovac, we have established a very stringent pharmacovigilance system to track and collecting the data, and also to do the analysis. So this is part of the services we need to conduct it. And of course, for this study, it only takes a year for us to get to this point. And all the trials, we still need to keep observing and keep studying the vaccine in order to do a further analysis on the products.
But what about the logic that while you are still waiting for the final data, it is safe to be put into emergency use?
Right. Actually, for emergency use, I think from different government, they balance the risk and benefit. And we have already provided a large amount of the safety data to the regulator in different countries. And also that was, some of them are arise from their local trials. So we believe that the regulator make the decision based on balancing the risk and benefit of using this vaccine.
Yeah. Well, a Brazilian doctor interviewed said that his confidence in CoronaVac was due to the open and transparent clinical trials held in his country. But are there any such trials being held in China using your vaccine, especially phase 3 trials?
Well, the other trials in China, I think if we're talking about CoronaVac, in China, we don't have, actually we feel very safe living here in China because there are not much reported cases. But in order to do the efficacy study, we do need to have an environment with certain incident rates to test whether the vaccine can provide protection. So we only conduct phase 1 and phase 2 studies in China, and the result has already been publicly reported and published on the Lancet previously.
In Chinese-made vaccine, there is this director of the Butantan Institute, Dimas Kovas, who said the suspicion of CoronaVac is due to its being Chinese-made. He said this trial shows our total transparency in the process. This vaccine was criticized for being developed in association with China, as if this were a sin. So how do you make of his comment, and have Chinese vaccines faced in general some kind of a discrimination when being promoted around the world? What is your company's experience?
I think it would. I will not be judging for the comments from others, but I think as a manufacturer, a vaccine manufacturer, it is our mission to develop and supply vaccines to help people, to protect people. It doesn't matter whether it is from China or from US or from UK. We only need to focus on whether we have a safe and effective vaccine, which could be deployed easily and can be provided good accessibility to the world to help people everywhere to going back to normal.
It seems there is an interesting phenomenon. Some call it catastrophic, of course. It's not nice because there is a great imbalance or inequality in terms of the distribution of vaccines. In some more developed countries, they have a greater number of vaccines, but in the other parts of the world, the number is much smaller. And it seems that Chinese-produced vaccines seem to be more used in developing countries and not in developed American or European countries. Is that a natural happening, or is that a matter of you're being not accepted in certain part of the world?
Well, actually, the focus of the territories is also part of our strategies, and that is started from why we're developing this vaccine. As I said, we're trying to provide a safe and effective vaccine to help people in the world. We believe that in US and UK, they have existing infrastructure industry who are capable of supplying vaccines. But largely amount of developing countries or undeveloped countries, they are not able to get fast access to the vaccines. That's why I think as a manufacturer in developing countries, we should take this responsibility to provide good vaccines to them. That's why we start from different continents in the developing countries. We believe that is the first action we need to do. It doesn't prevent us to go to US or UK in the future, but I think for the current situation under the pandemic, we need to get an equal access by different countries of having a good vaccine.
So at least for any people who want to get your vaccine, who live in a Western developed country, they have to wait, at least for now, right?
I think even for every vaccine manufacturer, they need to roll out the vaccine production lot by lot. So I think that's why at least for these first half years, I guess different countries need to develop a strategy of prioritizing the targeted group of vaccination. And then we need to work very closely with different countries to provide the vaccines to the use of vaccines on those priority lists. And then when the production is rolling out and supply is plenty, and then they can provide a larger amount of people to use the vaccine. I believe that's a practical strategy.
Finally, out of curiosity, what is the annual capacity of Sinovac right now, and how big is it going to be by the end of, let's say, 2021?
Sure. Actually, we build up our capacity only with 300 million doses. At the beginning, we thought we provide this for China to protect Wuhan. But lately, after this pandemic become global, we even before we complete the research, we already invest to double our capacity to 600 million doses per year. And we will be ready for that in the first quarter this year. And then we're also keep to expanding to 1 billion doses in around middle of this year. So if there is an additional need, we think we'll be ready to keep expanding it. And I think one of the advantage for our inactivated vaccine is not only safety, but also the transportation. We only require our vaccine be stored and transported at a 2 to 8 degrees Celsius. So which is a large amount of vaccine, massive delivery and access of the vaccine. And this is also a part of our advantage when developing this large quantity to undeveloped or even developing countries.